traumatic injuries and causation Hawks case. This statement unequivocally establishes that all current debilitating conditions, including specific cervical spine pathology, disc protrusions and osteophytes, and complex regional pain syndrome, CRPS, with its characteristic symptoms, are direct and sole consequences of the traumatic incident that occurred on February 20th, 2025. There were absolutely no symptomatic or functionally limiting pre-existing conditions in the cervical spine or any extremities prior to this specific event. Pre-accident baseline, undisputed functional health and absence of symptomatic pathology. Prior to February 20th, 2025, the individual possessed an objectively documented, robust level of physical health and functional capacity, with no history of cervical spine pain, radiculopathy, numbness, tingling, weakness, CRPS-related symptoms, such as temperature changes, allodynia, dystonia, or autonomic storms, or any functional limitations whatsoever in the neck or any of the extremities, upper or lower. This is irrefutably demonstrated by federally mandated medical clearances, DOT physicals. The individual consistently passed every required Department of Transportation, DOT physical examination. These are rigorous, federally mandated medical assessments designed to ensure a commercial driver meets strict physical and neurological standards for safety. Successful completion of these physicals, including one as recently as early October 2024 and logged in the employer system, provides definitive medical proof that the entire musculoskeletal and neurological system, including the cervical spine and all extremities, was healthy, asymptomatic, and fully functional, free from any conditions that would impair physically demanding work. Demonstrated high physical performance. The individual maintained an exceptionally active and demanding professional life that required sustained high levels of physical activity, agility, and strength. Extensive contract work. Successful completion of numerous 16 physically demanding contracts, including all assignments from the employer, unequivocally demonstrates the ability to perform strenuous tasks without any physical or neurological limitation. Visual documentation and musical proficiency. Available video evidence showcases the individual's dynamic physical attributes and high activity levels and professional capacities, actively moving and performing. Furthermore, the individual's ability to proficiently play guitar, bass, drums, and keyboards prior to the accident demonstrates exceptional dexterity, fine motor control, coordination, and physical stamina, directly contradicting any notion of pre-existing physical compromise or neurological dysfunction in any part of the body. Dedicated healthy lifestyle. For over 20 years, the individual has maintained a rigorous and disciplined healthy lifestyle, which includes strict adherence to a healthy diet, consistent daily exercise, complete abstinence from alcohol, smoking, and recreational drugs. This sustained commitment to health further substantiates an exceptional physical baseline and vitality, making any claims of health-related pre-existing conditions highly improbable. Medical and public observation of exceptional physical condition. Medical professionals, and even the general public, consistently observe the individual to possess a physical appearance and vitality significantly younger than chronological age, further underscoring a superior physical baseline and robust health status. In summary, objective medical documentation and irrefutable real-world functional evidence, supported by a long-standing commitment to a highly disciplined healthy lifestyle, confirm that the entire physical and neurological system, including the cervical spine and all associated extremities, was entirely asymptomatic, highly functional, and free from any debilitating conditions before the February 20th, 2025 accident. 2. The accident and clear progression of directly related injuries and syndromes. On February 20th, 2025, the individual experienced a specific traumatic incident that initiated a sequence of clearly identifiable and escalating injuries and medical conditions. 1. Immediate acute trauma. Day 1. On the very day of the accident, the individual presented with extreme bruising on the arm and a hematoma. These are undisputed, objective, and immediate physical manifestations of acute blunt force trauma directly sustained during the incident. 2. Delayed initial diagnosis due to staged medical evaluation. The comprehensive diagnosis of the accident-related injuries was delayed due to the initial sequence of medical evaluation. The first doctor treated for bumps and bruises, failing to order advanced imaging despite the trauma. The second doctor did not order an X-ray, further delaying the necessary diagnostic steps. It was only the third doctor who ordered the first MRI on March 11th, 2025. 3. Early diagnosis soft tissue injuries. March 11th, 2025 MRI. This first MRI, performed just 19 days after the accident on March 11th, 2025, revealed torn tendons and underlying tears in the affected extremity. These are specific soft tissue injuries directly consistent with acute trauma, and further confirm the direct physical impact of the February 20th, 2025 event on the individual's musculoskeletal system. 4. Complex regional pain syndrome, CRPS, diagnosed May 2024. Following the accident, the individual developed hallmark symptoms of complex regional pain syndrome. This condition was definitively diagnosed in May of 2024 by the hospital through a 3D nuclear bone scan. The CRPS symptoms include extreme temperature changes, alternating extreme cold and heat in the affected arm and neck, autonomic storms, indicating severe dysregulation of the involuntary nervous system, allodynia, where ordinary non-painful stimuli cause excruciating pain, dystonia, characterized by involuntary muscle contractions leading to abnormal postures. The development and objective diagnosis of CRPS within months of the inciting injury unequivocally link this profound neurological condition to the traumatic event, further highlighting the extensive impact of the accident on the individual's nervous system. The prior period of 4 months of no care except for physical therapy for autonomic storms, despite the May 2024 diagnosis, underscores a critical lack of early, specialized management for this complex condition. 5. Cervical spine pathology confirmed. June 2025 MRI. The most recent MRI revealing specific cervical spine pathology was ordered on June 16, 2025, performed on June 19, 2025, and its findings were received on June 20, 2025. This MRI definitively identified disc protrusions at C4-C5, C5-C6, and C6-C7. These are direct mechanical injuries to the intervertebral discs caused by the forces exerted during the traumatic event. Osteophytes, bone spurs, at C4-C5, C5-C6, and C6-C7. These bony changes, while potentially influenced by the body's repair processes, are considered to be either acutely caused or significantly aggravated by the trauma, leading to their symptomatic presentation and the observed structural instability/damage in the previously asymptomatic spine. Delayed presentation is consistent. The delay in diagnosing these specific cervical spine findings is medically consistent with a traumatic injury. Initial, more obvious acute injuries, like the arm bruising, hematoma, and tendon tears, and the complex, evolving CRPS symptoms can overshadow or precede the full manifestation or investigation of spinal pathology. The sequence of medical evaluations, necessitating multiple doctors to reach the point of advanced imaging for the spine, further explains why these findings were not diagnosed earlier. 3. Direct causation and irrefutable clinical radiological correlation. The entire spectrum of conditions, including the cervical spine pathology, disc protrusions and osteophytes, and the severe neurologically based symptoms and confirmed diagnosis of complex regional pain syndrome, are a direct and sole consequence of the February 20, 2025 accident. The immediate and severe onset of new and escalating symptoms, neck pain, radiating pain, numbness, tingling, weakness, temperature dysregulation, allodynia, dystonia, and autonomic storms, directly following the trauma, combined with the clear progression of medically confirmed injuries from day 1, and the subsequent diagnostic findings, establishes unequivocal causation. The MRI findings directly correlate with and explain the new neurological and pain symptoms experienced by the individual post-accident. Conclusion. Based on the overwhelming objective evidence of a healthy, asymptomatic, and physically robust individual prior to the traumatic event, as proven by federal medical certifications, documented physical capabilities, and a long-standing commitment to a highly disciplined, healthy lifestyle, coupled with the undeniable, sequential, and acutely traumatic injuries sustained, including the initial bruising and hematoma, confirmed torn tendons, the development and objective diagnosis of CRPS, and subsequent cervical spine pathology despite delays in initial medical assessment, any assertion of pre-existing, symptomatic, or unrelated conditions is directly and comprehensively refuted by the presented medical and functional evidence.